Hello, my name is Ann Coons. I'm a certified diabetes educator and I work for Citrus Valley Health Partners Center for Diabetes Education. And I'm here today to talk to you a little bit about diabetes. Our center is approved by the American Diabetes Association, and we're also an affiliate of the California Diabetes and Pregnancy Program, known as Sweet Success. One of the populations that really has my heart are those women that are pregnant with diabetes. It's very important for the woman with diabetes to have good blood sugar control. She can actually help prevent diabetes in her unborn child. What we know now is that if a woman has high blood sugars while she's pregnant, that sugar goes right over to the baby. The baby has to defend itself against all those high blood sugars, making extra insulin, and that extra insulin converts that sugar into fat, making for fat babies. Fat babies are very unhealthy babies. Their lungs tend to not be mature, they tend to be more premature, and we want those babies, like we say, to cook as long as they need to cook. In our gestational diabetes program, this is a wonderful opportunity to teach women about good health habits. A woman tends to be more motivated when she's pregnant because she's taking care of herself and an unborn baby. A lot of times women just don't take care of themselves if it's just for their own self. So this is our opportunity to help women learn to eat better, to exercise more. And as part of our program, we do ask the ladies not to give their children juice. And there's a lot of advertisements out there that say orange juice helps prevent cancer. But orange juice is very concentrated in sweetness, and you can get very comparable health benefits by having fresh fruit and drinking water. The problem with liquid calories is that it tends to cause more weight gain, tends to spike the blood sugars much faster than if you have the solid fruit. What's really sad about this generation, we estimate this is the first generation that parents will outlive their children. Children born now, we expect 1 out of 3 children to develop diabetes sometime during their lifetime. It's really sad. I've been a diabetes educator for 29 years, and when I first started, people with type 2 diabetes, which we call the old age diabetes, that would develop diabetes in their 40s and 50s, if they didn't take care of themselves, they might develop their first heart attack or stroke, maybe in their 50s or 60s. Now we're getting children that are 10 to 16. We've had a 10-fold increase in children from the ages of 10 to 16. And the youngest type 2 in our program is 4 years old. If these children don't take care of themselves, they're going to have their first heart attack, their first stroke in their 20s.